Good afternoon. Today, Public Health is reporting out 66 new positive tests of COVID-19 with a total of 885. Total deaths today, we are reporting out at 22 with an increase of 1. Total tests done at New Hampshire Public Health Lab and other selected labs, 9,608. The increase of 66 tests also reflects batch reporting that we get from Massachusetts Public Health Lab, where once a week or approximately once a week we get their positive results for New Hampshire residents. So of those 66, 10 of those came from Massachusetts Public Health Lab. We saw similar trends last week when we reported 81 last week. That day was also a day that the Massachusetts Public Health Lab did a batch report to us. The one additional death is a confirmed death, not necessarily in the last 24 hours, but we have received confirmation in the last 24 hours of that death, and that person is from Hanover Healthcare Facilities. That's all I have.
Thank you. Well, thank you very much, Commissioner. Today, I also want to provide an update and a preview on a few other items as we hit the weekend. First, there's been a lot of discussion over education funding in relation to the CARES Act and the opportunities that the CARES Act really can offer the state of New Hampshire. The Education Stabilization Fund portion of the CARES Act will provide New Hampshire approximately $82 million to help schools and institutions of higher education address issues surrounding COVID. So $82 million, that's a staggering amount of money, frankly, and we're very excited about the opportunities it will present our students and our kids across a variety of different branches of education. Approximately $9 million will be allocated to provide discretionary grants to K-12 students in higher education institutions significantly impacted by the COVID-19 crisis, and provide educational services, childcare, early childhood education, social and emotional supports. There's a lot of flexibility with that first $9 million out of that stabilization fund. Approximately $38 million will be provided directly to K-12 schools, distributed proportionally to the federal Every Child Succeeds Act Title I formula. So that's the formula we traditionally use for a lot of the education funding within the state, and the $38 million there will be distributed proportionally. Approximately $36 million to colleges and universities in New Hampshire, providing, I think, a lot of opportunity, given that the models we saw affected very, very drastically just prior to their April vacation, or I should say spring break. And leading into this, that was one of the first major institutions of New Hampshire to have to make some tough decisions. And again, we'll look at where those models go, but the $36 million provides a lot of opportunity for higher education in New Hampshire. And with the CARES Act, schools will also be able to cover costs associated with remote learning, cover costs associated with cleaning and sanitizing their facilities, extend the waiver on meals outside of the school environment through September of this year, and allow local schools to provide mental and emotional support for all students. So again, a lot of flexibility and a lot of opportunity for the students of this state coming through the CARES Act. Great opportunity, and obviously we'd like to thank the federal delegation, not just of New Hampshire, but really all across the country, folks stepping up, making sure that this type of funding was included in the Federal CARES Act and creating that opportunity here in the Granite State. Secondly, later today, I'm going to join the folks at SoClean. We've been hearing the SoClean story for all week. It's a great story, frankly, the fact that they're bringing in over approximately 20,000 masks per day over the next couple weeks, up to possibly a 250,000 N95 masks for the state of New Hampshire. It's a great opportunity, and I'll be joining them as they deliver about 3,500 masks to New Hampshire Hospital. They're a great employer, and again, you know, this is comes to a total of so far of about 175,000 N95 masks to over 200 healthcare facilities across the state this weekend. That's a tremendous opportunity, again, that they're providing a lot of the frontline healthcare workers stepping out of their normal distribution, out of what they do typically on a day-to-day basis, but also exploiting their connections overseas and making sure that we have a lot of the resources here, specifically the PPE resources for our frontline healthcare workers. We just heard our story not an hour ago, Sig Sauer over on the Seacoast area, a great manufacturer for the state of New Hampshire, also bringing in approximately 20,000 masks to healthcare facilities across the Seacoast. So every day we hear kind of a different new and good news story of another private sector or commercial provider stepping up, just trying to do their part to help the people of the state. And I think it's very reassuring, especially as we hit the holiday weekend. Ensuring our workers on the front lines that have adequate PPE is definitely a part of the solution, but we have to make sure that those healthcare workers, whether they're in long-term care facilities or hospitals, that they have the PPE, the equipment, and also, importantly, the financial resources. Those are all paramount pieces to combating this crisis. And as part of those efforts, early next week, I'll be releasing a plan currently in its final stages that will provide financial assistance to long-term care facilities and Medicaid providers that are struggling to retain workforce. These workforce incentives will help support those on the front lines of the crisis and ensure that our loved ones within those facilities have the care that they need. And finally, as a lot of you know, a lot of work gets done behind the scenes. I want to take a moment. We receive a lot of texts and calls after these press conferences on a variety of different issues, people asking different questions, and we try to respond to folks as many of the folks as possible. You see Commissioner Shibanet up here and Dr. Benjamin Chan stand with me. Other commissioners have stood with me as well. But one person that always gets missed a little bit and probably doesn't get the recognition he deserves is this guy right here, David. We get a lot of questions about David because he does such a tremendous job. He's been with me at pretty much almost all of the press conferences so far. David Kruger, and also, I got this right, Jody, right? And Lori? Do I have it? Amora's here today. There's here, why don't you guys come up? Yeah, come on up. Come on up. I'm the governor. I get to demand certain things. So just a quick say thank you. This is a great example of folks that are behind the scenes just doing a great job. See, I've caused problems now because it gets a little hard. But again, these are the American Sign Language interpreters that work with David because the interpretation David does is it's really advanced. It's actually very progressive for the state of New Hampshire. And not all the states do it, but we kind of go out of the box a little bit and work with an entire team to make this happen. So, thank you. Oh, thank you very much. Thank you, guys. I appreciate it. I mean, it's one of those things where you want to bring everybody up here who's behind the scenes, whether they're at the Emergency Operations Center, folks that work with us here internally, different people all throughout the state. So again, we can't thank them enough. And in closing, as we head into Easter weekend, for those currently celebrating Passover, there's obviously a lot to be thankful for. And we talk about this a lot. We have to remember that these holidays, they're about salvation and deliverance and finding a lifeline through very tough times when sometimes it seems like all hope is lost. Well, hope is not lost here in New Hampshire. We are not down and out by any means. The times definitely aren't normal, but the people in New Hampshire, they're tough and they're resilient. And I think this is a weekend in some ways coming at the best of times, right? When we need it the most to remember what is out there to be grateful for, the time to spend maybe a little extra time with family or loved ones. The stay-at-home order is tough. We appreciate that. So you can't necessarily gather with a lot of other folks that we typically would be gathering with during this holiday weekend. But we want to say thank you to everybody, and hopefully everyone has a safe and happy holiday in whatever means and kind of the new norms that we're celebrating holidays together. But it is a time to be, I think, very reflective and grateful for the opportunities that we have and know that there is hope at the end of this. And together, we all, as we always say at the end of these press conferences, we're going to get through it, and we're going to stick together, and we're going to know that there is a light at the end of that tunnel. There will be an end to this at some point, and if we do stick together and stay resilient, there's nothing New Hampshire can't do. With that, we can open up for some questions if anyone has anything.
Governor, you issued an executive order yesterday about relaxing some state agency requirements. It was primarily in Department of Environmental Services. Whether it's air quality, water quality, hazardous waste. All state agencies have a lot on their plate right now, but is there any good time to unilaterally say your permits, your tests don't have to be completed for as long as 6 months. in many
Sure,
cases.
sure. So the question revolves around one of my latest executive orders, flexing out some of the time requirements on permits, specifically within environmental services. A lot of folks, a lot of the environmental permits that are required have certain timelines when the department has to respond by. And again, we want to make sure that those timelines, for the most part, are adhered to. Of course, we want people to get certainty with their projects and going forward, but also respecting that with a lot of more individuals within the Department of Environmental Services having to work remotely, there may be a little extra time that is needed. So, as on a per need basis, it isn't necessarily a blanket, but upon my approval, we can flex some of those time frames. We don't want to flex it too far because we want people to know whether things are going forward or not. Government is still open here in New Hampshire, to be sure, but we're just trying to provide the department a little more flexibility in terms of making sure that they're not held to a standard and guideline given these new norms, at least in the temporary, while the state of emergency order is in place, that they'll have a little flexibility and not violate their own rules, essentially. And so to the bigger question, is there a way to do that unilaterally? On a kind of a department-by-department basis, whether it's DOT, Environmental Services, Health and Human Services. We work with our commissioners very closely, and if there's a need there, we're always willing to entertain what the need is, but also make sure that we're not providing so much flexibility that the rules just go out the window, right? Government is open and operating. We want to make sure people stay within those guidelines, but also provide the realistic flexibility that can be expected given the new situation from an employment standpoint, individuals working from home and whatnot. Thank you.
Just from Commissioner Shibinette, it sounds like it's, but we just want to hear from you. So this was a resident of the Hanover Hill long-term care facility, and they were an older person with underlying health conditions?
Yes, confirm both. Yep.
Great.
Commissioner, earlier you said that lack of PPE and or lack of testing have not been what you call the limiting factor in dealing with outbreaks in nursing homes. You know, Hanover Hill, they've told New Hampshire Public Radio, they told the union leader that PPE is an issue there.
PPE is an issue all over the state, but we've been able to, and they've been able to procure, and we've been supplying them with enough PPE to take care of their patients. So everybody gets worried when you get down to your last 2 days or your last 3 days, but every time they get to that point, we send them, whatever we have in reserves. We hold back very little at the department when it comes to PPE because everybody's in great need, but the reason why we hold some of our shipments back is for an outbreak at a long-term care facility that only has a limited number of limited amount of PPE. So when we have something like Hanover Hill or some of the other facilities that are struggling, there has never been a point in my awareness, and I've talked to the administrator of that facility several times, there's never been a point where she has told me that they've run out of PPE, and no facility has told me that.
So does the Office of Long-Term Care Ombudsman, have they been doing anything to address some of the issues at the long-term care facilities?
Long-term care ombudsman has been very involved right from the very beginning, 6-7 weeks ago, when we started talking with our long-term care facilities about how to account for the psychosocial well-being of their residents, why we are in a no visitor status. So we went into a no visitor status many weeks ago for long-term care facilities. That can be a very lonely place for long-term care residents. So, if you follow any of them on social media, you'll see them posting videos and pictures and all of these great things. The other things they're doing that the long-term care ombudsman was very involved in was making sure people had what they needed to be able to start Skype visits and do other things like that. And that's really been the great involvement. They certainly can still investigate complaints. A lot of that is done by phone just to make sure that the facility has thought of other things that they can do if there's a complaint to a long-term care facility. But as the governor said, government's still open and we're still doing all the things that we've been doing.
Maybe both of you could answer this question on the relaxation of some of the licensure requirements. I mean, there seem to have been hundreds of people who have been now licensed under the emergency standards. A lot of them are essentially, behavioral people. How is that working? And are those people out there working right now? I mean, I'm just procedurally, they're now out there and can provide services, or are they? How's that working?
Oh, I thought you were
Oh, no,
Sorry,
no.
Sure. Yeah, so I apologize. The question revolves around a lot of the newer individuals, given our flexibility with licensure, how that is working and then how they essentially get placed, right? Is that the question? Yeah. So there's a variety of different means. Sometimes those individuals might be from out of state, and we want to make sure that they can, if let's say they live in New Hampshire, they typically work in Massachusetts, but they actually want to practice in New Hampshire for a variety of reasons given the current crisis. Sometimes they can come through an existing hospital or healthcare facility, given their variety of expertise, whether it's behavioral health or even on the medical side. The certification requirement also flexibility allows people within state. Typically, a lot of the healthcare workers get, I think is the word certified with a facility? I think that's credentialed. Credentialed. I always use the word certified. If you're credentialed with a certain facility, we allow some flexibility there. So if you're credentialed with one facility, you can now work within another facility, at least on a short-term basis, depending on where the need might be within New Hampshire. So there's a variety of different ways that it works. I can't tell you that everyone who has gotten that waiver is working today. They might be. Some of them got the waiver and they're kind of waiting to see if they're called upon or where the need might be, depending on the surge or things of that nature. I think do we have some to take on the phone?
Well,
I'm sorry. Oh, sure.
If the fiscal committee met today, they accepted federal aid to help with meals at congregate homes, and obviously there's been some difference of opinion about the necessity of the fiscal committee accepting or approving disbursement of money. I mean, do you see? You indicated that you saw their role as only really advisory during this crisis. Do you see that changing based on representations today by Chairman Wallner that the committee can meet any time and is
No, we don't see that changing. Again, the fact that we've created this advisory group that actually can now move at the speed that we need to move within the Governor's Office for Emergency and Relief and Recovery, that's an office that can and has to move very quickly. And now, instead of the typical legislative process, which can take time because of public input and all that, that's a great process for certain things, but not ideally designed for the speed at which we need to move. But now this advisory group moves with us at that very speed. And my sense is that over the next week, as now Director Little, former Commissioner of the Banking Commission, Jerry Little, who's going to head up the Gopher, which is our office, and working with them on a very, very direct basis, on a consistent basis, transparency. I think a lot of the concerns that may have existed initially with the fiscal committee will be allayed by the fact that they have real input in the process. There's transparency in there. They have a very important voice in that process, and we want that to be there, but we also need it to move as quick as we need to move. So I think folks are going to be very pleased with the opportunity that the legislature, both Republican, Democrat, House, and Senate, are all going to have through their leadership to participate in the process.
Well, one thing that came up during today's meeting was the fund that you set up to benefit healthcare facilities and the money that went to Lakes Region.
The hospital fund, yes.
And Karen Rounds was on the conference call, and she indicated that she was maybe part of a committee of 4, I think. Maybe, I don't know if the commissioner's on as well, but a couple of people from Health and Human Services, somebody from Revenue, someone from the Attorney General's office, but that ultimately this was all just kind of ultimately under the auspices of your office.
Yes.
And, so thus far, there's been very little disclosed about the scope of, we know there's $50 million in there. We know the list of people who've applied. Mm-hmm. Reporting we've done suggests it far outstrips the $50 million.
It does.
That's been put in. Why not make the request public?
I'm sorry, what request?
The request that
of the facilities
providers might have made to receive taxpayer money.
Sure. So right now, I think as folks receive money, taxpayer money, that will be made public. We don't want to disclose all the potential requests because in some ways you can unintentionally publicly disclose financial insecurity or not insecurity with a single institution, whether they are or not getting public funds. But anyone who does get public funds, of course, will be very transparent about it. And again, just as a reminder, we opened that up and we knew a lot of folks would apply, and over 200 healthcare facilities did apply for those funds. Some of those needs were immediate, and we're addressing those with LRGH and a few others. Some are more just kind of long-term financial wants. And so we're trying to make sure that we prioritize the needs. We want to make sure the doors are open specifically to healthcare facilities that are going to deal with the COVID-19 crisis. For example, we had a lot of dentists that applied for those funds, and there's need there, to be sure. But right now the priority is on some the hospitals in particular, and making sure that folks that are going to need beds and ICU or hospitalization because of the COVID-19 crisis, obviously those facilities are going to rise to the top. Doesn't mean we won't get to the others. Also, with the guidance that comes in for the $1.25 billion, we still don't have it yet. No one's really seen it yet, so we can speculate. But with that guidance, as it comes in, we'll have a better understanding of what opportunity those federal dollars can be used to also help some of the second and third, I call it the second and third tier facilities, not in quality of care, of course, but just in terms of financial need. And so those doors will open up as well. So we've created the fund to address immediate needs, so no one was shutting their doors. There's probably a few more folks that will tap into that fund. But to your point, we'll probably need more than $50 million, and the hope is that with the flexibility, with the $1.25 billion, the input from the Legislative Advisory Committee, the great team we're putting together to run Gopher, I think all those pieces will come together to make sure that we're closing those gaps one way or the other. Yes, sir.
In Massachusetts, Governor Baker advised all Bay State residents to wear masks when they go out in public. Is that something that could be coming down the line here in New Hampshire?
Well, I think we're following the CDC guidelines, which says if you're out in a public atmosphere where there could be congregation, where you could, maybe it's a grocery store or whatever it might be, we're telling folks to look at those CDC guidelines, and if and when possible, to wear those masks. Again, I believe I got to be careful. I believe the CDC guidelines talk about the fact they don't want folks wasting medical grade like N95 masks, so to say. The mask wearing within public is often about making sure you don't transmit, even if you're asymptomatic, transmit the virus to others. That's why folks might wear, cloth masks or bandanas or something just to limit the amount of moisture, because this does travel with water droplets that might come out of your mouth to another individual. I posted myself in a grocery store the other day. I couldn't believe the response that got, actually, but it was good. I mean, the message was really there. We all have a responsibility to take. It is not mandated. I don't know if they're mandating it out of Massachusetts. It's an advisory. It's not even mandated out of Massachusetts. And again, understand Massachusetts has a very different level of contagion than we have here. The same virus, of course, but given their densities, and it's obviously the impact has been exponential to the state of New Hampshire. So again, we're trying to promote that exact same model. And again, if we can keep the good social disciplines, the good physical distance, and maybe add in some of these other opportunities for individuals to protect themselves, their loved ones, and the people in their community, that's always a good thing. Yes, sir. Hi.
I have a question for the commissioner. About a week ago, the DHHS put out a health alert stating that there was about a quarter or so of the confirmed cases were healthcare workers in the state. Is that still the case, and what's that number looking like now?
I don't have the exact number of healthcare workers, but I can confirm that it's still between 25 and 30% of our total positive cases.
And you'd issued another order, Governor, or the commissioner could speak to it as well, about alternative temporary congregate housing for healthcare workers who may be at risk of contracting the virus, and they're fearful of infecting members of their own household. Is that kind of housing, is that still theoretical, or do you really think you're going to need to make use of that?
We're already making use of that. So the department, in collaboration with both the Department of Safety and the National Guard, set up several facilities that can either be used as respite for perhaps any type of healthcare worker that is traveling long distances to work in a health setting, for first responders that may have been exposed and don't want to go home to their family until they get confirmation. We've set up quarantine sites for the general public to make sure that everybody has a safe place to quarantine and not need to go home to their families. So we've contracted with several sites already, and they're actively being used.
Commissioner, can you just explain, when you talked about the batch reporting? I think if we interpret that correctly, you're saying essentially this might look like an increase in cases for today, but it just means we're getting more results. So it's not necessarily, since we saw 40s, 30s, 60, even though we're going to see some uneven days potentially, this one is a little bit out of the norm what you're saying?
Yes, so 10 of those 66 came from Massachusetts Public Health. They weren't all positive tests from last night. So what typically happens, Massachusetts Public Health will notify, the patient and maybe their healthcare provider, but they will batch the reporting to New Hampshire Public Health all in one day so that they're not sending results every single day to us. But the patient's already been notified and the provider's already been notified. So yes, we've seen 30s and 40s for the last several days, up to 66 today. 10 of those are from Massachusetts. I think we're still in the range, although it's a little higher today even than previous days. But as we've said numerous times, 1 or 2 or 3 days worth of data does not indicate a trend or a pattern. So we just need to be careful. I think it's great to be hopeful, for sure, when we see lower numbers, but we know that they can bounce up and down day to day.
Do we have some questions from on the phone?
The first
Thank you.
question comes from Holly Raymer with Associated Press. Holly, go ahead with your question.
Hi, thank you. I know you said that the details will be coming next week about the financial assistance for long-term care facilities, but can you talk a little bit about just sort of the scope of the problem that you're seeking to address there, and any details you could share about what that help might look like?
So the question revolves around the financial assistance package that we're going to be talking, kind of providing in more detail early next week. We're looking at a variety of different models and scenarios. We've been talking to other governors in other states, looking at what they're doing, looking how it might work here in New Hampshire, working with the opportunity that could be at the federal government, and if there's time delays there, how we kind of fill in the holes, so to say, because we want to make sure that some type of help is coming in very short order. This package would pertain not just to long-term care facilities, but other Medicaid providers, in-home care services with within the DD community, direct service providers. There's a lot of different ways that I think there's some opportunity to provide help and financial incentive to a lot of the frontline workers. I guess the details would look, what we're looking at is some type of combination with what the opportunities at the federal government, and again, using whether it is a short-term fund here in New Hampshire that I can set up through an executive order, or potentially something that would be used with the $1.25 billion discretionary fund that we'll have access to, again, to kind of making sure we provide some type of supplement. The area of most need is a lot of folks in specifically around long-term care, the public long-term care facilities in particular. A lot of those workers, again, are having to make tough decisions about coming in. There's concern that they're coming in and potentially spreading the virus or not. They're weighing that out with a variety of different variables. Again, we are making sure that they have the PPE and the equipment, but a financial incentive there is also an important piece of the puzzle. And other states have looked at it. We're looking at it to make sure whatever we do fits within our model, our framework, something that is affordable and that we can provide and shore up the system in the short term.
The next question comes from Paula Tracy with InDepth. Paula, go ahead with your question.
Yes, hi, Governor. It was to see you today in Concord, and I wanted to ask a little bit about the costs associated with these flex care places. Do we have any idea what kind of FEMA money is available for not only equipping these places, but manning them? Is that something that they cover in terms of the people who work there and the equipment?
So, Ms. Tracy's question revolves around a visit I had earlier today to another one of our Flex and Surge facilities. NHTI, part of the community college system, working with Concord Hospital, Lakes Region General Hospital, as well as the hospital up in Franklin, all using that as one of our new flex facilities. They got it up and running very, very quickly, which is wonderful. No need for it right now, and hopefully we never need it, to be honest. The question revolves around the costs. Right now, we have, I think, a very good deal with FEMA in that they'll take up about 75% of the unrecouped cost. Now, the recouped cost could come from a variety of different sources: the private insurers, the hospitals themselves, maybe even Medicaid, or there's a variety of different ways that could come in. Right now, I believe most of it is a 75-25 deal, so FEMA picks up about 75%. We'd pick up the other 25%. The important aspect of that is if there's any costs above and beyond what would come from those organizations I just mentioned, the state will step in and help backfill or pick up the rest. There will be no cost borne by the local cities or towns involved with these facilities or the organizations that are providing the services. In this case, NHTI or SNU, that's working, that's doing it in Manchester, or there are some local public high schools that are also donating some of their facilities with their gyms. And again, those cities and towns won't bear those costs. We will bear the bulk of them. The costs are not actually very high. We don't estimate. If you look at whether it's a cost per person that might be in there or the overall cost of setup, the ancillary services such as food or even Wi-Fi, right? If somebody's going to be in these facilities for potentially a couple of days, we want to make sure they have access to communication services, and these would be more convalescing beds, again, more on the back end of someone's potential stay in a hospital. So we don't anticipate there being a need for ventilators or ventilator type machines in there. It'll be the equipment need is fairly minimal. We'll be able to staff whatever we need, but the equipment need is fairly minimal, which keeps the cost fairly minimal as well. So FEMA, long story short, FEMA picks up the bulk of the costs. Some of the other providers in that model, whether it's the hospitals and insurance companies, can pick up the rest, and the state will be providing support as well.
The next question comes from Ethan DeWitt with the Concord Monitor. Ethan, go ahead with your question.
Hi, Governor. I wanted to go back to the fiscal committee question. I know this has been asked a lot, but on a separation of powers question, right now there's the legislature and there's the executive. In 2018, the voters delivered a split verdict, and there is now divided government with two parties in control. If the process moves ahead through this office, and there is no fiscal oversight, and there's just an advisory body that doesn't actually have the ability to vote down anything, how is the legislature on equal footing with the executive? And if something egregious were done by the executive, does the legislature have any power at that point to put a brake on it?
So the question revolves around the separation of powers. Again, let's remember we're in very unique times. There is a state of emergency that I've declared, and will likely be in a state of emergency for quite some time. The need of the state of emergency was designed by the legislature and with the very explicit intent of allowing the governor in times of emergency to move very, very rapidly to respond with action or financial resources as necessary. And that's exactly the situation that we have found ourselves, unfortunately, over the past month, and will likely be in for some time to come. So I think the legislature actually did a very good job defining that opportunity for the governor to act and react as necessary, sometimes not day to day and week to week, but hour to hour. And we've seen how fast that this not just how fast the virus moves, but how fast the state has had to move. And allowing my office to move with that speed has allowed the state to be in a much better position from a public health standpoint than a lot of other areas. We took very severe action, very tough decisions to be sure, but very severe action early on. And because of that, we don't find ourselves in the same position as a Boston or a New York or some of the other, New Jersey, some of the other states around the country. And again, I'm very proud of the team that came together and all worked with us on a one-on-one basis and said, these are the very tough decisions that have to be made. So the separation of powers issues, it's not political. It has nothing to do with party. It doesn't have to do with a Democrat-led legislature and a Republican-led governorship. That doesn't come into the equation at all. It's all about allowing the governor and to move with the speed with his executive branch, because the governor is the sole manager of the executive branch. The legislature does not have management of the executive branch. The governor does, and whether it's Chris Sununu or former Governor Hassan or Governor Lynch, going all the way down the line, those are the positions. You always need somebody in position from a managerial standpoint to move forward. The advisory group, again, is going to be involved in every step of what the governor's office for emergency relief and recovery is going to be taking. There's going to be nothing done behind closed doors. There's going to be complete transparency. It's not window dressing by any means. It's actually being there step by step with us all along the way. And again, we've included an equal number of Republicans and Democrats from the House, from the Senate. We've included members from the Fiscal Committee that will actually be there hand in hand in allowing them. This is actually a very innovative way to allow them, the legislature that typically moves incredibly slowly, to allow them to move at the speed that we need them them to move. And I think as the process takes shape and moves forward as early next week, I think they'll find that they have a real voice in that process. At the end of the day, under the state of emergency, the governor has to make the final decision. That's the way it has been. That's the way it was designed, and that's a responsibility I take very seriously. And I think we've handled our entire team has handled very, very well to date, and we're going to continue to do so. And now to have that legislative input in this, I think will be very valuable.
Have you talked to them about this? I mean, you seem to indicate that you think they're going to be pleased with their role. I'm not getting that sense from them. Obviously, nothing's happened yet. But
nothing's happened yet.
Have you talked this through with them?
I have talked this through with them. Yeah, very much so. Yeah.
The next question comes from Rick Jurgens with the Valley News. Rick, go ahead with your question.
Hi, Governor. I have a question about long-term care facilities. The CDC and CMS guidelines suggest that the state and local officials should be working with nursing home operators to designate separate facilities or units for COVID-19 residents or those still in unknown status. Could you tell me what you're doing, or is that something that's being considered or being implemented to set aside those facilities that could segregate COVID-positive residents?
Hi, thank you for the question. This is Commissioner Shibinette. So we have had those discussions and looked around the state, and we've identified a couple of facilities around the state that have either open units or maybe a closed long-term care facility that we could use if we needed to stand up a COVID-only facility. When we look around the country, we've seen those actions, some being successful and some not being successful. Right now, what we encourage our facilities to do is that if you have a group of COVID-positive patients or patients that are displaying symptoms of COVID, that you cohort them together. This is not uncommon. Long-term care facilities do this also when you have influenza in your building or a norovirus in your building, is cohorting both the residents and the caregivers that are taking care of those residents.
But right now, there's no need to actually. I mean, are we close to needing to stand up one of those facilities?
No.
Great. All right, well, if there's no other questions, again, we just want everyone to have a safe and happy holiday weekend. Let's remember what the weekend is all about and know that we may be in for the long haul, but we're resilient as Granite Staters. We're grateful for the blessings that we have, and we are going to get through it. Thank you, everybody. Be well.